So the synoms which are used for the supporting cusp include central cusps. We also know holding cusp because it prevents the drifting, and also the passive eruption of teeth. Stem cusps is also known as. You can see here this mandibular arch facial occlusal line. The mandibular arch is smaller than maxillary that we know, so the supporting cusps are located on the facial occlusal line. Okay, these mandibular lingual cusps that overlap the maxillary teeth are non-supporting cusps. Mandibular right quadrant, you can see here the facial outline. The mandibular supporting cusps are located on the facial occlusal line. This line moves towards like moving outside. Now in C, the proximal view of molar teeth in occlusion. Mandibular supporting cusps in opposing maxillary fossa. It is moving into their fossa. Okay, you can see here the maxillary supporting cusp in opposing mandibular fossa. Okay, you can see this maxillary right quadrant which has actually lingual occlusal line. Supporting cusps are located on the lingual occlusal line in maxillary. Here it was actually facial or labial, you can say, and here it is actually opposite lingual side. Okay, then lingual view of the left dental arches in occlusion, you can see here, and it is actually lingual view. Okay, very important. Then this is the facial view of them. Then you have mandibular non-supporting cusps. Okay, maxillary supporting cusps include the opposing fossa on the means. The maxillary supporting cusps include what? They actually include their fossa and marginal ridges. In actually maxillary non-supporting cusp, they remove the, okay, so mandibular supporting cusp including again fossa and all the marginal ridges. So you have learned about them. Okay, that they form maximum intercuspation. They support the vertical dimension. They are near to the facial-lingual center. Then the non-supporting outer incline has actually potential for contact, more rounded than the non, means they are more rounded in their cusps. So here they discuss a very important point, that the lingual taper of posterior teeth, the teeth that are actually lingually tilt, due to which the height of the relative height of functional cusp increases with respect to the non-functional cusp, and the central fossa of the functional cusp are obscured by the overlapping of non-functional cusps. During fabrication of restoration, when you restored any tooth, it is important that functional cusps are not contacting the opposing teeth. Means the functional cusps are not contacting the opposing teeth in a manner that results in a lateral deflection of teeth. So that will result in a lateral deflection of teeth. Rather, the restoration should provide contact on the platinous or smoothly concave fossa, so the masticatory forces are directed approximately parallel to the long axis of teeth. The non-functional cusps overlap the opposing teeth without contacting the tooth. Okay, and non-functional cusps form a lingual occlusal line in the mandibular. Very important. Non-functional form lingual line. Lingual. Okay, and the facial occlusal line in the maxillary arch. The non-functional are located on the, they are actually located in the anterior posterior plane in the facial embrasures or in the developmental grooves of opposing teeth, creating alternatively arrangement when teeth are in maximum intercuspation.